everyone, I'm Burchette, and today Arielle, Carman, and I will be discussing the role of the acute care nurse practitioner with you. There are about 270,000 licensed nurse practitioners in the United States, according to the American Association of Nurse Practitioners. As of 2015, acute care nurse practitioners made up about 5% of this total number. This may be due to the fact that the acute care nurse practitioner, or ACNP, is the newest specialty to emerge within advanced practice nursing. In fact, it is so new that the first national certification exam wasn't administered until 1995. Going back a little further, the acute care nurse practitioner specialty came about in the late 1980s when many nurse practitioners were working in the hospital setting. The need for more specialized training emerged at this time, and the adult specialty arose. The ACNP is very similar to other nurse practitioner specialties in that they can care for a wide range of patients. But what makes the ACNP unique is that they also have the skills to care for very complex and ill patients. The main difference between other specialties and the ACNP is the type of patient they are caring for, the criticality of the patient, and the setting in which they are being treated. The ACNP can be defined as a nurse practitioner who is able to diagnose and manage disease in adult patients with acute, critical, or complex conditions. As with any advanced nursing practice degree, the ACNP requires at minimum a master's level degree. The ACNP also requires the knowledge of specialty skills and knowledge of how to care for acutely or chronically ill patients. They must also meet the standards of practice set by the ACNP licensure organizations. The ACNP may work in neurology, pulmonology, pre- or post-surgical areas, emergency rooms, rapid response teams, and many other specialties. As the field grows, many ACNPs are working in specialty services such as clinics, medical rehabs, long-term care facilities, and on-flight teams, to name a few. The ACNP's scope of practice is influenced from many different levels, including the national, state, local, service-related, and individual levels. The scope of practice at a national level includes performing comprehensive health assessments, ordering and interpreting tests and procedures, formulating differential diagnoses, and to order, provide, and evaluate the outcomes of the interventions. The American Association of Critical Care Nurses makes it clear that ACNPs do not require oversight by a physician, but instead their role should be defined as a collaborative arrangement with other members of the healthcare team. The designation as a licensed independent practitioner will vary based on state regulations, however. All states regulate advanced practice nursing based on nursing licensure, but many states have included specific requirements for the APRN. Many states are defining the scope of practice to be consistent with the APRN consensus model, which differentiates between acute care and primary care nurse practitioners. This would ensure that the NPs are caring for the appropriate population that their education prepared them for. The ACNP's role may be further defined by their employer and what is allowed in their job description or what they are credentialed for. The institution may not supersede state or national limits, but it can limit the scope of practice how they see fit. The institution will likely require proof of licensure, certification, educational information, malpractice insurance, and information on skill performance, like the number of procedures performed or proof of competence of procedures. Furthermore, the ACNP job requirements may be adjusted based on the type of specialty service they are employed on. Lastly, the scope of practice is defined by what the ACNP is personally able to do. Experience, interest, confidence, personal ethics, and other characteristics all may play a part in determining what the ACNP is able or comfortable doing. Next, we will discuss the 7 core competencies, starting with direct clinical practice. Direct patient care takes up the majority of an ACNP's time, as they are spending most of it caring for these acutely and critically ill patients. Of vital importance is that the ACNP has a strong background in patient care, likely from his or her nursing background. The type of patients that these ACNPs are treating can develop life-threatening complications surreptitiously and fast. One of the goals of the ACNP is to stabilize the patient and prevent additional complications. If complications do arise, it is vital that the ACNP can minimize the long-term effect on the patient. The ACNP also needs to tend to other comorbidities and ideally improve the long-term health of the patient to maximize the health potential. In some situations, this may not be possible, and the ACNP will also need to provide palliative or supportive end-of-life care for their patient. The relationship between the nurse practitioner and the patient is still vitally important in the acute care setting. However, the care team is expanded in these situations to involve more providers and specialty services. This can include other nurses, respiratory therapists, other doctors or nurse practitioners, pharmacists, physical and occupational therapists, and social workers. The ACNP will likely be the go-between with the patient and all the different services, explaining what is going on and why. The ACNP can provide education and insight into the plan of care for the patient and family, and also help make the illness feel more manageable. This competency is indispensable at the time of discharge, when the need for education may be the highest. Sometimes family members are quickly thrown into situations where they will be caring for someone who now has a disability due to the illness. The ACNP may also follow up with patients after discharge to monitor any signs or symptoms of further exacerbation of their illness. Lastly, the ACNP may also provide coaching for nurses on their unit and education on these complex medical issues. The ACNP may consult with a variety of different services during their care of a patient. As previously mentioned, this can include a whole variety of different services. These exchanges of information can be done formally as well as informally. It is incredibly useful in situations like in teaching hospitals when the care team may be rotating and the ACNP is the only constant provider in the patient's care team. He or she is able to provide consistent care and inform new members of the team about the patient's history as well as any new changes in their condition. Utilizing evidence-based care and practice is essential to any nurse practitioner, and the ACNP is no exception. Staying current on the newest literature and developments in technology allows the ACNP to improve their individual practice as well as influence practice in their facility. This can also correlate with the previous competency consultation, as the ACNP can further education at their facility through in-services with other providers and nursing staff. The ACNP is a leader in the sense that they are in the provider role and can serve as mentors or coaches for the nursing staff. They can also use their leadership skills to drive their knowledge of evidence-based practice techniques and work to get new policies implemented. There have been several studies that have shown that when an ACNP is in charge of the oversight of services, that length of stay is shorter and emergency room visits after discharge are less. Another area of leadership within the ACNP role is the planning and oversight of cost-effective initiatives. In some facilities, there's another leadership role the ACNP can function in. This role is similar to a managerial role in that there is a lead nurse practitioner who oversees a group of advanced practice providers in a designated area. This person can assist with administrative details, conflict resolution among the group, serve as a main point of contact, and be the expert within the team. In the acute setting, collaboration is almost always a given. As we have discussed, there can be many different providers caring for one patient, and there is a shared responsibility for decision-making. The ACNP is part of this group, and therefore, successful collaboration skills are a must for any ACNP. There sometimes is a dissonance created between the nursing staff and the doctors, as the two teams may not agree on the plan of care. The ACNP can function as a mediator in these situations to bridge the gap and create a collective environment. Because of the nature of the care provided, ACNPs are often put into situations where their ethical decision-making skills will be tested. This may include transitioning a patient towards end-of-life care. The ACNP, using their leadership and collaboration skills, can be instrumental in navigating these situations. One of the main challenges of the role is the other members of the care team being unfamiliar with the ACNP specialty. They may not understand the additional education and experience with acute and chronically ill patients that the ACNP provides, as well as the training for these complex and often critical situations. Because of this, other members of the team may assume that the ACNP is unable to perform more multifaceted procedures or cares for the patient. Some providers assume that the nurse practitioner is merely a physician extender, who is more than a nurse but less than a doctor. These misconceptions about the ACNP can delay care for the patient and cause dissonance between members of the care team. Through education and discussion, the ACNP can help inform these team members of what their role actually is and how they can work collaboratively together. As discussed earlier, some ACNPs are finding positions outside of the hospital setting. This can cause issues with credentialing and obtaining privileges. Can also cause issues with legal contracts. Managed care organizations can have problems with it, and also problems with reimbursement. Lastly, as the specialty continues to grow, the need for more educational programs grows, and additional training for the specialty will be needed. The role of the ACNP continues to grow and expand. There is a consensus with the Institute of Medicine and the APRN consensus model that the ACNP is the appropriate preparation for nurse practitioners taking care of critically ill populations. The role may further develop so that the ACNP is managing patients outside of the hospital during exacerbations of illness, with the hope of eliminating the need for rehospitalization or decreasing the length of stay. The future also includes ACNPs staying involved in the legislative process so that nurse practitioners can help influence the decision-making process and bring insight into potential setbacks or issues within the role. The ACNP may be the newest specialty for nurse practitioners and may only make up 5% of all nurse practitioners, but they are tremendously important to the care team of these complex patients. The ACNP can greatly improve the care of the patient and decrease length of stay and ER visits after discharge. They can also assist in creating a team approach to healthcare by corralling the different specialties within the care team and providing holistic care to the patient. Allowing the ACNP to work within their full scope of practice is important, but may be met with some resistance initially. This specialty is trained for acute and chronic illness and complex medical cases. As the specialty continues to grow, so will the knowledge of the title, and with that, so will grow the provider comfort and acceptance of the role. Thank you.